Question 1. A client with septic shock is receiving norepinephrine infusion. Which assessment finding indicates the medication is achieving its intended effect? A. Urine output decreases to 15 milliliters per hour. B. Mean arterial pressure increases to 68 millimeters mercury. C. Heart rate increases to 140 beats per minute. D. Lactate level rises from 2 to 6 millimoles per liter. Answer. B. Mean arterial pressure increases to 68 millimeters mercury. Rationale. Norepinephrine is a vasopressor used in septic shock to increase systemic vascular resistance and improve perfusion pressure. The target MAP in septic shock is greater than or equal to 65 millimeters mercury, indicating adequate organ perfusion. Question 2. A mechanically ventilated client suddenly develops high peak airway pressures and decreased oxygen saturation. The nurse notes absent breath sounds on the right side. What is the priority action? A. Increase FiO2 to 100%. B. Prepare for chest tube insertion. C. Administer bronchodilators. D. Suction the endotracheal tube. Answer. B. Prepare for chest tube insertion. Rationale. These findings suggest tension pneumothorax, a life-threatening complication of mechanical ventilation requiring immediate decompression and chest tube placement. Question 3. A client with traumatic brain injury has an intracranial pressure ICP reading of 24 millimeters mercury. Which intervention should the nurse implement first? A. Lower the head of the bed. B. Hyperoxygenate the client. C. Maintain the head of bed at 30 degrees. D. Increase environmental stimulation. Answer. C. Maintain the head of bed at 30 degrees. Rationale. Elevating the head of bed promotes venous drainage from the brain, reducing ICP. Normal ICP is 5 to 15 millimeters mercury, and values above 20 require intervention. Question 4. A client receiving heparin infusion for pulmonary embolism has an APTT of 120 seconds. What is the nurse's priority action? A. Increase the infusion rate. B. Stop the infusion temporarily. C. Administer vitamin K. D. Continue infusion as prescribed. Answer. B. Stop the infusion temporarily. Rationale. Therapeutic APTT for heparin is 60 to 80 seconds. An APTT of 120 seconds indicates excessive anticoagulation and increased bleeding risk. The infusion should be stopped and the provider notified. Question 5. A patient with acute respiratory distress syndrome, ARDS, is on mechanical ventilation with PEEP of 12 centimeters H2O. Which complication should the nurse monitor for? A. Metabolic acidosis. B. Decreased cardiac output. C. Hyperkalemia. D. Polycythemia. Answer. B. Decreased cardiac output. Rationale. High PEEP increases intrathoracic pressure, which can reduce venous return to the heart, leading to decreased cardiac output and hypotension. Question 6. A client with diabetic ketoacidosis, DKA, is receiving IV insulin. Which finding indicates therapy is effective? A. Blood glucose decreases by 10 milligrams per deciliter per hour. B. Blood glucose decreases by 70 milligrams per deciliter per hour. C. Urine ketones increase. D. Serum potassium rises above normal. Answer. B. Blood glucose decreases by 70 milligrams per deciliter per hour. Rationale. During DKA treatment, glucose should fall 50 to 75 milligrams per deciliter per hour, indicating appropriate insulin therapy. Question 7. A client develops ventricular tachycardia with a pulse. The client is hypotensive and diaphoretic. What intervention should the nurse anticipate? A. Immediate defibrillation. B. Synchronized cardioversion. C. Administration of atropine. D. Observation and monitoring. Answer. B. Synchronized cardioversion. Rationale. Unstable ventricular tachycardia with a pulse requires synchronized cardioversion to restore normal rhythm. Question 8. A burn client in the resuscitation phase shows urine output of 10 milliliters per hour. What is the nurse's priority action? A. Decrease IV fluids. B. Increase IV fluid rate. C. Administer diuretics. D. Restrict fluids. Answer. B. Increase IV fluid rate. Rationale. Low urine output indicates inadequate perfusion during burn resuscitation. Fluid replacement should be increased to maintain urine output greater than 30 milliliters per hour. Question 9. A client with myocardial infarction suddenly develops pulmonary edema. Which assessment finding supports this diagnosis? A. Dry cough. B. Pink frothy sputum. C. Bradycardia. D. Warm dry skin. Answer. B. Pink frothy sputum. Rationale. Pulmonary edema often presents with pink frothy sputum, crackles, and severe dyspnea due to fluid accumulation in alveoli. Question 10. A client with sepsis has a lactate level of 6 millimoles per liter. What does this finding indicate? A. Adequate tissue perfusion. B. Severe tissue hypoxia. C. Respiratory alkalosis. D. Improved metabolic status. Answer. B. Severe tissue hypoxia. Rationale. Elevated lactate levels indicate anaerobic metabolism due to inadequate tissue perfusion, a hallmark of severe sepsis and septic shock. Question 11. A client with septic shock is receiving aggressive fluid resuscitation. Which parameter best indicates that fluid therapy is adequate? A. Central venous pressure of 3 millimeters mercury. B. Urine output of 45 milliliters per hour. C. Heart rate of 120 beats per minute. D. Respiratory rate of 30 per minute. Answer. B. Urine output of 45 milliliters per hour. Rationale. Adequate urine output, greater than 30 milliliters per hour in adults, is one of the best indicators of improved renal perfusion and effective fluid resuscitation in shock states. Question 12. A patient on mechanical ventilation begins to trigger high-pressure alarms. The nurse notes thick secretions in the endotracheal tube. What is the priority action? A. Increase ventilator tidal volume. B. Suction the endotracheal tube. C. Administer sedatives. D. Reduce ventilator rate. Answer. B. Suction the endotracheal tube. Rationale. High-pressure alarms commonly indicate airway obstruction, such as secretions, biting the tube, or bronchospasm. Immediate suctioning restores airway patency. Question 13. A client with acute kidney injury has potassium level of 6.8 milliequivalents per liter and peaked T waves on ECG. Which medication should the nurse expect to administer first? A. Sodium bicarbonate. B. Calcium gluconate. C. Furosemide. D. Kayexalate. Answer. B. Calcium gluconate. Rationale. Calcium gluconate stabilizes the cardiac membrane and is the immediate treatment for life-threatening hyperkalemia with ECG changes. Question 14. A patient with ARDS is placed in the prone position. What is the primary purpose of this intervention? A. Reduce pulmonary secretions. B. Improve alveolar recruitment and oxygenation. C. Decrease ventilator rate. D. Increase lung compliance. Answer: B. Improve alveolar recruitment and oxygenation. Rationale: prone positioning improves ventilation perfusion matching and oxygenation in severe ARDS by recruiting posterior alveoli. Question 15. A client with cardiogenic shock is receiving dobutamine infusion. Which outcome indicates the medication is effective? A. Decreased cardiac output. B. Increased stroke volume. C. Reduced urine output. D. Increased systemic vascular resistance. Answer: B. Increased stroke volume. Rationale: dobutamine is an inotropic agent that increases myocardial contractility, leading to increased stroke volume and improved cardiac output. Question 16. A patient with increased ICP suddenly develops bradycardia, hypertension, and irregular respirations. What condition should the nurse suspect? A. Neurogenic shock. B. Cushing's triad. C. Hypovolemic shock. D. Brainstem herniation syndrome. Answer is B. Cushing's triad. Rationale: the combination of bradycardia, hypertension, and irregular respirations indicates Cushing's triad, a sign of dangerously increased intracranial pressure. Question 17. A patient receiving continuous renal replacement therapy, CRRT, becomes hypotensive. What is the nurse's first action? A. Stop anticoagulation. B. Reduce fluid removal rate. C. Administer potassium. D. Increase dialysate flow. Answer is B. Reduce fluid removal rate. Rationale: CRRT removes fluid gradually. Hypotension often occurs from excessive fluid removal, so the rate should be reduced immediately. Question 18. A client after coronary artery bypass surgery suddenly has chest tube output of 250 milliliters in 1 hour. What is the nurse's priority action? A. Document as expected finding. B. Notify the surgeon immediately. C. Clamp the chest tube. D. Lower the head of bed. Answer is B. Notify the surgeon immediately. Rationale: chest tube drainage greater than 200 milliliters per hour after cardiac surgery suggests active bleeding and requires immediate medical evaluation. Question 19. A patient in septic shock has the following hemodynamic values: MAP 55 millimeters mercury, CVP 10 millimeters mercury, and SCVO2 55%. What does this indicate? A. Adequate oxygen delivery. B. Inadequate tissue oxygenation. C. Fluid overload. D. Normal perfusion. Answer is B. Inadequate tissue oxygenation. Rationale: low SCVO2, less than 70%, indicates tissues are extracting excessive oxygen due to poor perfusion, meaning oxygen delivery remains inadequate. Question 20. A client with acute pancreatitis develops sudden respiratory distress and hypoxemia. Which complication should the nurse suspect? A. Pulmonary embolism. B. ARDS. C. Pneumothorax. D. Atelectasis. Answer is B. ARDS. Rationale: Severe pancreatitis can trigger systemic inflammation leading to acute respiratory distress syndrome, causing severe hypoxemia and respiratory failure. Question 21. A client with septic shock is receiving norepinephrine and adequate IV fluids. Blood pressure remains low with MAP 58 mm mercury. Which medication should the nurse anticipate adding next? A. Vasopressin, B. Furosemide, C. Metoprolol, D. Atropine. The answer is A. Vasopressin. Rationale. If hypotension persists despite fluids and norepinephrine, vasopressin is commonly added as a second vasopressor to increase systemic vascular resistance and improve MAP. Question 22. A mechanically ventilated patient suddenly develops low pressure alarms. What is the most likely cause? A. Airway obstruction, B. Disconnected ventilator tubing, C. Secretions in the airway, D. Bronchospasm. The answer is B. Disconnected ventilator tubing. Rationale. Low pressure alarms typically indicate air leak or disconnection in the ventilator circuit, preventing adequate pressure from building in the airway. Question 23. A patient with traumatic brain injury has ICP 22 mm mercury. Which intervention should the nurse avoid? A. Neck flexion, B. Elevating the head of bed, C. Maintaining neutral head alignment, D. Limiting suctioning. The answer is A. Neck flexion. Rationale. Neck flexion impairs venous drainage from the brain, increasing intracranial pressure. Question 24. A client with acute myocardial infarction develops cardiogenic shock. Which hemodynamic finding is expected? A. Increased cardiac output, B. Decreased systemic vascular resistance, C. Elevated pulmonary capillary wedge pressure, D. Low central venous pressure. The answer is C. Elevated pulmonary capillary wedge pressure. Rationale. Cardiogenic shock results from left ventricular failure, leading to elevated PCWP due to pulmonary congestion. Question 25. A patient receiving propofol infusion for sedation develops sudden hypotension. What is the nurse's priority action? A. Stop the infusion temporarily, B. Administer naloxone, C. Increase infusion rate, D. Administer atropine. The answer is A. Stop the infusion temporarily. Rationale. Propofol commonly causes vasodilation and hypotension, especially in critically ill patients. The infusion should be paused and hemodynamics reassessed. Question 26. A burn patient 12 hours post-injury becomes restless and confused. Vital signs show tachycardia and hypotension. What is the most likely cause? A. Sepsis, B. Hypovolemic shock, C. Neurogenic shock, D. Pulmonary embolism. Answer: B. Hypovolemic shock. Rationale. During the early bun resuscitation phase, massive fluid shifts lead to intravascular fluid loss and hypovolemic shock. Question 27. A patient on mechanical ventilation develops sudden hypotension, distended neck veins, and tracheal deviation. What condition should the nurse suspect? A. Pulmonary embolism, B. Cardiac tamponade, C. Tension pneumothorax, D. Atelectasis. Answer: C. Tension pneumothorax. Rationale. Classic signs include hypotension, tracheal deviation, distended neck veins, and sudden respiratory distress, requiring emergency decompression. Question 28. A client with severe sepsis has urine output 10 milliliters per hour despite adequate fluids. Which complication should the nurse suspect? A. Acute tubular necrosis, B. Diabetes insipidus, C. Hypervolemia, D. Metabolic alkalosis. Answer: A. Acute tubular necrosis. Rationale: persistent oliguria in sepsis often indicates acute kidney injury caused by ischemic damage to renal tubules. Question 30. A patient with liver failure becomes confused and develops asterixis. Which laboratory value should the nurse anticipate being elevated? A. Ammonia. B. Creatinine. C. Sodium. D. Calcium. Answer: A. Ammonia. Rationale: elevated ammonia levels lead to hepatic encephalopathy, producing confusion, altered mental status, and asterixis. Question 31. A client with ARDS has worsening oxygenation despite high FiO2. What is the next ventilatory strategy likely to be used? A. Decrease PEEP. B. Increase PEEP. C. Reduce tidal volume. D. Decrease respiratory rate. Answer: B. Increase PEEP. Rationale: increasing PEEP helps keep alveoli open, improving oxygenation in patients with severe ARDS. Question 31. A client with septic shock is receiving norepinephrine and fluid resuscitation. Urine output remains 15 milliliters per hour, and lactate is rising. Which intervention should the nurse anticipate next? A. Administer diuretics. B. Initiate continuous renal replacement therapy. C. Increase sedation. D. Restrict fluids. Answer: B. Initiate continuous renal replacement therapy. Rationale: persistent oliguria and rising lactate despite resuscitation suggest acute kidney failure and worsening perfusion, often requiring CRRT in critically ill, unstable patients. Question 32. A mechanically ventilated patient with ARDS is on low tidal volume ventilation. Why is this strategy used? A. Prevent respiratory alkalosis. B. Reduce ventilator-induced lung injury. C. Increase carbon dioxide elimination. D. Improve airway resistance. Answer: B. Reduce ventilator-induced lung injury. Rationale: low tidal volume ventilation, 4 to 6 milliliters per kilogram, prevents barotrauma and volutrauma, which can worsen lung injury in ARDS. Question 33. A patient with massive pulmonary embolism suddenly becomes hypotensive and confused. What is the priority intervention? A. Administer thrombolytic therapy. B. Start IV fluids only. C. Administer bronchodilators. D. Place the patient in Trendelenburg position. Answer: A. Administer thrombolytic therapy. Rationale: massive pulmonary embolism causing hemodynamic instability requires immediate thrombolysis to dissolve the clot and restore pulmonary circulation. Question 34. A client with cardiogenic shock has the following findings: BP 82/50, crackles in lungs, and decreased urine output. Which medication should the nurse expect? A. Dobutamine. B. Norepinephrine. C. Epinephrine. D. Dopamine. Answer: A. Dobutamine. Rationale: dobutamine improves myocardial contractility and cardiac output, making it the preferred inotropic agent for cardiogenic shock. Question 35. A patient with increased ICP requires endotracheal suctioning. What is the most important nursing action before suctioning? A. Hyperoxygenate the patient. B. Lower the head of bed. C. Increase sedation. D. Reduce ventilator rate. Answer: A. Hyperoxygenate the patient. Rationale: suctioning can cause hypoxia and transient increases in ICP, so pre-oxygenation helps prevent secondary brain injury. Question 36. A patient with septic shock develops disseminated intravascular coagulation, DIC. Which assessment finding is most consistent with this complication? A. Hypertension. B. Excessive bleeding from IV sites. C. Bradycardia. D. Hyperglycemia. Answer: B. Excessive bleeding from IV sites. Rationale: DIC causes widespread clotting followed by consumption of clotting factors, leading to uncontrolled bleeding. Question 37. A client receiving potassium replacement develops peaked T waves and muscle weakness. What is the nurse's priority action? A. Stop potassium infusion immediately. B. Increase infusion rate. C. Administer insulin. D. Administer calcium. Answer. A. Stop potassium infusion immediately. Rationale. Peaked T waves indicate dangerous hyperkalemia requiring immediate cessation of potassium administration. Question 38. A patient with cardiac tamponade presents with hypotension, muffled heart sounds, and jugular vein distension. What is the priority treatment? A. Pericardiocentesis. B. Chest tube insertion. C. Defibrillation. D. Vasopressor therapy. Answer. A. Pericardiocentesis. Rationale. Cardiac tamponade compresses the heart, impairing cardiac output. Pericardiocentesis removes fluid from the pericardial sac, restoring circulation. Question 39. A client with severe ARDS has PaO2 55 mm mercury despite maximum ventilator support. Which therapy may be initiated as rescue treatment? A. Extracorporeal membrane oxygenation, ECMO. B. Incentive spirometry. C. Nebulized bronchodilators. D. Chest physiotherapy. Answer. A. Extracorporeal membrane oxygenation, ECMO. Rationale. ECMO provides temporary oxygenation and carbon dioxide removal outside the body when conventional ventilation fails. Question 40. A patient with traumatic brain injury has serum sodium of 158 milliequivalents per liter and high urine output. What condition should the nurse suspect? A. Syndrome of inappropriate antidiuretic hormone. B. Diabetes insipidus. C. Acute renal failure. D. Hyperaldosteronism. Answer. B. Diabetes insipidus. Rationale. Head injury can damage the pituitary gland, causing diabetes insipidus, leading to excessive urine output and hypernatremia. Question 41. A client with septic shock suddenly develops mottled skin, decreasing urine output and worsening hypotension despite vasopressors. What stage of shock is most likely occurring? A. Initial stage. B. Compensatory stage. C. Progressive stage. D. Refractory stage. The answer is C. Progressive stage. Rationale. In the progressive stage of shock, compensatory mechanisms like the RAAS system and sympathetic nervous system begin to fail. The body can no longer maintain cardiac output, leading to profound tissue hypoperfusion and the start of multi-system organ dysfunction syndrome, MODS. Question 42. A mechanically ventilated client develops sudden oxygen desaturation and agitation. The nurse notes the ventilator high pressure alarm and unilateral chest expansion. What is the priority action? A. Increase FiO2. B. Auscultate lung sounds immediately. C. Administer sedatives. D. Increase ventilator tidal volume. The answer is B. Auscultate lung sounds immediately. Rationale. Unilateral chest expansion suggests possible pneumothorax or tube displacement. Rapid assessment with auscultation helps identify the cause before intervention. Question 43. A patient with cardiogenic shock has the following hemodynamic profile: high CVP, high PCWP, and low cardiac output. Which intervention is most appropriate? A. Administer IV fluids rapidly. B. Administer diuretics and inotropes. C. Restrict oxygen therapy. D. Lower the head of bed. The answer is B. Administer diuretics and inotropes. Rationale. Cardiogenic shock causes fluid congestion and poor cardiac pumping, requiring medications to improve contractility and reduce fluid overload. Question 44. A patient with traumatic brain injury is receiving mannitol. Which finding indicates the medication is effective? A. Decreased intracranial pressure. B. Increased heart rate. C. Increased blood pressure. D. Decreased urine output. The answer is A. Decreased intracranial pressure. Rationale. Mannitol is an osmotic diuretic that reduces cerebral edema and lowers intracranial pressure. Question 45. A client with ARDS has plateau pressures greater than 35 centimeters H2O on the ventilator. What complication is the nurse most concerned about? A. Atelectasis. B. Barotrauma. C. Pulmonary embolism. D. Hypokalemia. The answer is B. Barotrauma. Rationale. High plateau pressures indicate excessive alveolar pressure, increasing risk of alveolar rupture and pneumothorax, barotrauma. Question 46. A patient with severe sepsis develops confusion and hypotension. Laboratory results show platelet count 45,000 and prolonged PT/PTT. What condition is occurring? A. Hemolytic anemia. B. Disseminated intravascular coagulation. C. Acute leukemia. D. Immune thrombocytopenia. Answer. B. Disseminated intravascular coagulation. Rationale. DIC is characterized by low platelets, prolonged clotting times, and bleeding, often triggered by severe sepsis. Question 47. A client after major trauma develops sudden shortness of breath, petechiae on the chest, and confusion. What complication should the nurse suspect? A. Pulmonary embolism. B. Fat embolism syndrome. C. Pneumonia. D. ARDS. Answer. B. Fat embolism syndrome. Rationale. Classic triad of fat embolism syndrome includes respiratory distress, neurological changes, and petechial rash, typically after long bone fractures. Question 48. A client with acute renal failure has metabolic acidosis and potassium level of 7.0 MEq per liter. Which therapy should the nurse anticipate first? A. Calcium gluconate administration. B. Sodium restriction. C. Potassium supplements. D. Diuretic therapy. Answer. A. Calcium gluconate administration. Rationale. Calcium gluconate stabilizes cardiac membranes, preventing lethal arrhythmias during severe hyperkalemia. Question 49. A patient with severe traumatic brain injury shows sudden fixed dilated pupils and loss of brainstem reflexes. What does this finding most likely indicate? A. Improved cerebral perfusion. B. Brain herniation. C. Mild concussion. D. Normal neurological recovery. Answer. B. Brain herniation. Rationale. Fixed dilated pupils and loss of reflexes indicate brainstem compression from herniation, a life-threatening neurological emergency. Question 50. A patient in septic shock shows improving MAP, decreasing lactate levels, and urine output 40 milliliters per hour after treatment. What does this indicate? A. Worsening shock. B. Adequate response to therapy. C. Kidney failure. D. Metabolic crisis. Answer. B. Adequate response to therapy. Rationale. Improved perfusion indicators such as stable MAP, decreasing lactate, and adequate urine output suggest successful shock management. As we wrap up this hard ICU case study breakdown, remember that critical care nursing is not just about memorizing facts. It's about thinking fast, recognizing subtle changes, and making life-saving decisions under pressure. The ICU is where small clinical clues can mean the difference between rapid deterioration and timely intervention. The more case studies you practice, the sharper your clinical judgment and NCLEX readiness will become. If this breakdown challenged your thinking, that's exactly the goal. NCLEX and real ICU scenarios are designed to test how you analyze complex patient data, prioritize interventions, and anticipate complications. Make sure you like this video, subscribe to MCQs Master 101, turn on notifications so you never miss the next set of high-level NCLEX and critical care questions. And before you go, pause the video and drop your answer in the comments. What was the most critical clinical clue in this case? Keep sharpening your nursing brain, because here on MCQs Master 101, we don't train average nurses. We train nurses who can think in the ICU.